So there are lots of common questions and rumors about risks for Alzheimer's disease and how you might catch it, and so I want to talk about a few of those. Okay, well, some people have said it, just trust me. Common medications for GERD include the proton pump inhibitors, or PPIs. A few of them on here, I would guarantee at least one person's on at least one of these. Prilosec, Protonix, Nexium, Prevacid, Acid, Hex. Good news is there have been several studies that have looked at this, and there's a very large study of over 3,400 people where they screened them for dementia every 2 years for a mean follow-up of 7.5 years. And these were people that were taking the PPIs. And they found that PPI use was not associated with a risk of dementia. So as of right now, we don't have evidence that supports PPI use being associated with an increase of dementia. Okay? So if you're taking one of those medications, don't worry, you can keep taking it. We don't have evidence right now that that causes dementia. So I don't want you people walking around with reflux because the doctor said that it causes dementia, because I don't have evidence that it does. Okay? Now, anticholinergics. Who here is on an anticholinergic? Who here doesn't know what an anticholinergic is? You might be the only person in the room that knows what an anticholinergic is. So, you know, it's not a huge class of medications. Here are just a few that fall into the anticholinergic group. So, you know, I mentioned that there will be a quiz at the end of this. So just remember 20, 25 of these, and that you'll get a good enough score on the exam. So, bottom line, don't memorize this list. Just ask your physician, okay? These medications have been associated with cognitive decline. Now, sometimes there are very good reasons to be on an anticholinergic medication. And so that's why it's important to have a discussion with your physician, because it's all about weighing the risks and benefits, okay? A lot of what I've been showing thus far is showing the attributable risk of a risk factor to causing dementia. So if you've got a risk somewhere else, you have to weigh these alternating forces to figure out what's going to be best for you, okay? All right, I've heard that my cholesterol medication could cause Alzheimer's disease. Anyone heard that one? Oh man, well that's good, because I don't have any evidence that that's the case either. And I'll show you that there have been some very good studies. This one came out in 2013, and just so you kind of know the chart that we're looking at here, each one of these studies, so 1, 2, 3, 4, 5, 6, 7, 8 studies, they put all the data from those 8 studies together and did something called a meta-analysis, so that we can increase the power of our study by pooling other studies together, okay? And what they found was that of those people using statins, okay, and I'll show you what the statins are here in a minute. It's a cholesterol medication. But of those people using statins, there was actually a decreased risk of developing dementia, or cognitive decline in the case of this paper. And this blue diamond being to the left of the one line is what means there's a lower risk of developing cognitive decline. Okay, so there's another paper that came out in 2016. They looked specifically at the use of statin medications, so simvastatin, atorvastatin, pravastatin, rosuvastatin, or what you may better know them as are Zocor, Lipitor, Pravachol, and Crestor. Anyone on those? Yeah. So these medications, they looked at 405,000 statin non-users, and then roughly around 200,000 statin users, and compared low exposure, so low dose medication users, to high dose medication users and non-users. And they looked to see who developed dementia. And what they found was that in the low exposure group, none of these were as high as the non-users. And look at this, in the high exposure group, it was even less of a risk. So this study and the other study suggest that statins don't actually lead to dementia. They may be protective against dementia. Now this is kind of interesting, because remember on one of the first slides I showed you, one of the risk factors for dementia or Alzheimer's disease are cerebrovascular or cardiovascular risk factors, things like blood pressure, diabetes, high cholesterol. So it kind of makes sense that we're seeing these numbers And it's certainly a breath of fresh air when there have been some rumors that statins cause dementia. We don't have evidence that that's the case.